Hello all. Concepts for optimizing antimicrobial prescribing. I remember a note given by Benjamin Franklin. The best doctor gives the least medicine. Now, a presentation. Let's see key facts about antimicrobial resistance. Antimicrobial resistance is a global health and development threat. It requires urgent multi-sectoral action in order to achieve the sustainable development goals. It's like a silent killer pandemic going on, and it requires sustainable development goals. WHO declares that MAR is one of the top 10 global public health threats facing humanity. Misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens. The cost of AMR to the economy is significant. In addition to death and disability, prolonged illness results in longer hospital stays, the need for more expensive medicine, and financial challenges for those impacted. Without effective antimicrobials, the success of modern medicine in treating infections, including during major surgery and cancer chemotherapy, will be at increased risk. Another quote I would like to remember here is the medicine is a science of uncertainty and an art of probability, which is given by Sir William Osler. Let us understand the problematic misconception. The result of a diagnostic test undoubtedly determines the presence or absence of disease. Positive results makes a disease or condition more likely, but not certainly, while a negative results makes a disease or condition less likely. An infectious disease test can be negative when a person is truly infected. Reality common reasons for this include inadequate sampling and transport practices or the timing of collection. So that's the problematic diagnostic test interpretations. The dilemma is that the bacterial and the viral infections are often clinically indistinguishable. To treat or not to treat with antibiotics for bacterial or viral infection is a puzzle. Diagnostic uncertainty leads to antibiotic misuse. 50% of the overuse is because of this uncertainty. Every second antibiotic is erroneously prescribed for a viral infection. However, also 20% of the antibiotics are underused. Fifth of the patients with a bacterial infection do not receive antibiotics. The consequences of the overuse includes adverse events and emergence of resistance, while the consequences of the underuse includes prolonged disease duration, complication, and hospitalization. Antibiotic overuse leads to bacterial resistance, one of the most global healthcare problems of our time. Resistance to antibiotics could bring an end to the modern medicine as we know it. This is rightly said by WHO. The consequences of bacterial resistance you can see from the slide. There is a high death rate, the illness, and annual cost is too high. So for this fight against antimicrobial resistance, we need an integrated approach, also called as a theragnostic approach, which includes approach from all these levels, say from infection control, from antimicrobial stewardship, and diagnostic stewardship. Integrated this approach is together we will call as a holistic integrated approach or theragnostic approach. What is diagnostic stewardship? It's a coordinated guidance and interventions to improve appropriate use of microbiological diagnostics to guide therapeutic decisions. Which will promote appropriate timely diagnostic testing, including specimen collection and pathogen identification, and accurate timely reporting of results to guide patient treatment. So diagnostic stewardship is more test centric. Unlike the antimicrobial stewardship, which is more pharmacy or antibiotic centric. Diagnostic stewardship, in short, is the right test for the right patient at the right time and with the results at the right for the right indications. Although routine, the process of ordering and interpreting the diagnostics is very complex and results often in diagnostics errors. COVID remains a critical and complex issue worldwide, especially during the respiratory season months. Sepsis is of a concern also. The availability of fast diagnostics is the key to treating the patients with such dangerous viral or bacterial infections without sacrificing the antimicrobial stewardship efforts. And what are the diagnostic errors that we often say? It's a delayed diagnosis or wrong diagnosis or misdiagnosis. Delayed diagnosis refers to a case where a diagnosis should have been made earlier. Often many illnesses aren't suspected until symptoms appear. So delayed diagnosis, for example, includes example of cancer. Failure to use the specific testing in the specific clinical syndrome, for example, Legionella antigen detection in communicable pneumonia. So that's examples of a delayed diagnosis. Similarly, wrong diagnosis occurs when, say, for example, routine urine culture in asymptomatic patients. It often gives colonization growth, and it is when the patient is treated falsely on the basis of the urine culture positivity. Also, treatment of enteric fever based on rapid cut test. So these are the examples of wrong diagnostics. Another thing noted in diagnostic error is a misdiagnosis. Misdiagnosis refers to patients whose medical complaints are never explained. Cultures are sent after antibiotic administration. For example, viral in the first week of fever, IgM testing in the first 3 days of fever for leptospirosis, strep typhus. That was about the different types of diagnostic errors. Now, effective diagnostic system is more complex and more important than ever. Making diagnostic safety your measurements priority is now an urgent requirement. Why diagnostic errors are common, harmful, and costly? 1 in 20 adults will experience a diagnostic error in the outpatient setting every year. About 250,000 harmful diagnostic errors occur yearly in US hospitals. Now, how does this is that was of the how why the diagnostic occur are common. Now, how does it occur? Identify the diagnostic safety events to learn what symptoms and processes or systems and processes to improve. Step by step, have a plan to check, act, or a similar such planning uh, to understand how to apply strategies to analyze the diagnostic tests and learn from the diagnostic errors. Now, when you will do, whether you are just starting or ready to scale up, or your organization can do this now, you can start up with diagnostic stewardship. Your organization can begin to find opportunities to improve diagnostic using data you already have, scale up your diagnostic safety, and uh, put up the interventions with monitoring and supervision over the interventions. Correct diagnosis and treatment is key for the patient safety and quality of patient care. Diagnostic stewardship is an essential partner to antimicrobial stewardship. Patients frequently present with non-specific symptoms, which means healthcare providers often rely on the guesswork and serial lab tests, some of which don't provide actionable results. So, important patient management decisions should be made before receiving a lab result. Determining the best treatment, allocating necessary manpower and resources on a case-to-case basis, even if a pathogen specific result never materializes. So that was about the diagnosis stewardship, a holistic approach. It is an opportunity for a lab infectious disease partnership. It requires a seamless partnership so that appropriate tests are ordered and diagnostic information is translated into appropriate management in real time. It requires a collaboration of laboratories, microbiologists, and ID clinicians. The goals of improving diagnostics is to facilitate more effective teamwork in the diagnostic processes among healthcare professionals, enhance the healthcare professional education and training in the diagnostic process, ensure that the health information technologies support patients and healthcare professionals in the diagnostic process. About the prescription of antimicrobial prescribing. In the next session, we'll see in details. Thank you.